السلايد شو خليني انك تعملها فول. Good morning. Dear guests, dear nurses, it's a pleasure for me to be here in the first symposium for the nursing. I'm sorry, the color is really, I didn't know that it's going to be so lighted, but what I'm going to speak about is what is the innovation, what are the components of the innovation, and some of the nursing facts, nursing care and what does it affect, the challenges, what is going on in the world about innovation, and some of our suggestions. What is innovation? It's a new idea or method that we bring into our practice. It's about doing things differently or doing different things to achieve, of course, the quality improvement in patient care, our aim and our target always. Innovation can be viewed, sorry, is that okay? Okay. Innovation can be viewed as a process for inventing something new or improving something that we have and bringing some new ideas to it. It's creating new resources, processes, or values, or improving an organization's or our existing resources, processes, or values. It is not limited to leaders, not limited to directors, not limited to the chiefs and managers. It comes from everybody, and the most important innovative ideas comes from those who are at the bedside care, from the nurses who are caring immediately in direct care with the patient. Why? Because they are the one facing the problems and trying always to solve the problem. That's why their innovative ideas are the most important. Why do we need innovation? And I think Dr. Sahar has spoken about this. Innovation, we are always looking forward for improvement in quality and in patient care and patient safety. Innovation is at the center of that. And of course, we know that the healthcare services are growing in demand, and we are touching and realizing that every day. And we don't want to forget that there is always a global workforce shortage of nurses, and we are all suffering from that. The fact is that the nurses are the fundamental to high quality of patient care. And without them, what would it be? I don't know. Without nurses, we can hardly find an intervention, treatment, or any program that the nurses are not of it, or not even the key role of this. There is a global, undisputable, non-negotiable acknowledgement that the nurses are and are playing a key role in determining the quality of health care and enabling people to make choices in public and in public health and in the hospitals and the organizations. We are always in direct contact with the patients, and the one who are explaining, we are the one who are touching, we are the one who are in direct contact with them, communicating with them, and involving them in their plan of care. Nurses have a major role in health promotion and illness prevention, of course. Who is not encountered with many questions and from family, from relatives, from the public being a nurse? Everybody is coming and asking you. But this cannot be built without somebody who is recognizing that and somebody who is supporting whatever ideas or innovations are there. Well, nursing, and you all agree with me, is a complex, demanding professional requirement knowledgeable skills, and it is coming from a critical thinker. We need to be critical thinker, and with a huge amount of dedication, commitment, and hard work. Who is not providing hard work? Who is not doing over whatever he is or she is supposed to do? What does nursing care affect? Research have been proving that nursing care affects many aspects. These are some of them only: patient care and outcomes, patient safety, patient satisfaction, organizational cost, organizational profitability, hospital reputation, mortality rate, length of stay, infection rate, patient education, risk management, patient fall, pressure ulcers, incidence or variances, and of course it affects also their life. I'm sure everybody would agree with me. Well, what is the world is doing for the nurses who are leading through innovation? Healthcare system was traditionally accepting rules and support the rules and regulation, but now there is an emphasis for innovative ideas and for changes in the world, in the healthcare work environment or industry. Centers of Medicare and Medicaid services are the insurance payer in the states. They do pay for the healthcare demander or the customers. With the American Nursing Association, ANA, they have a project which started long time back, and there is a website for them. If you enter that website, would tell you, for you nurses, if you have an idea, please tell it to us. So anybody who has an innovative idea is entering there and is giving their idea. Once they enter there and they provide their ideas, they are supported for a year to practice that idea and to show that this idea is really leading to improvement in care and decreasing the cost. Of course, they care about the cost. Nurses are continuously selected as innovation advisors. So this is really to be proud of. Some of them, or I list for you 3 examples of what happened there, and whoever is has given their innovative idea. One was an expert in wound care. She's a wound care nurse. She was really expert in her job. She was consulted by physicians, by nurses, giving education to nurses, approaching the patient, teaching about measures of the prevention and how to treat the wound care. So she decided that she has an innovative idea, and she went there and she put her name and put her innovative idea. She was really supported. She was supported in doing analysis, in being very good in healthcare finance, and she started applying her idea in a long-term facility, where you know that long-term care facilities have the majority is wound patients with wounds. So she studied there. She interacted with the staff, educated the staff, approached the patient, and imagine within first 3 weeks, after the first 3 weeks that she was there, she succeeded in decreasing by half the number of wounds occurring to the residents of this long-term facility. Another example is a president who was a president for care services. She had the idea to look why are patients returning back to the hospital. Why are they really, after discharge, coming back? So she wanted to study this idea. And she said, if we know why, we can prevent that from happening. So also, she submitted her idea. She analyzed the cases. She found many criteria that are leading to the patients after discharge to come back and to be readmitted again. So she succeeded in creating a tool that providers make decisions in real time based on the data, so that patients' needs are met before they are discharged, being in medication, being in treatment, being in any technology that they need. The third example is about improving continuity and care coordination. The former president of American Nurse Association, ANA, She created a new staffing role called attending nurse. The attending nurse was attending the patients, and she was the one who is admitting the patient, following up the patient whom she admitted even after several days of admission. And she used to coordinate with the staff, the assigned nurses who are taking care of that patient. And it was a tremendous success. So attending nurses look for any gaps in care and unmet needs that patient and their families may have from admission to post-discharge. They also may carry a light patient assignment. Was really successful in doing that. What are the components of innovation? We need an individual or a team creative idea, but this is not enough. We need the innovation to be an excellent product which meet the demand. We don't want to invent something or to create something or give an innovative idea for something that we don't need. So wherever the environment is, the innovation should be related to the need and also a supportive and related to the innovative process environment, including its social, cultural, and physical aspect. It is critical for providing the creativity opportunity in which the innovation can take place. What are the challenges? We nurses are used to face challenges. Do you agree? The challenges is the nursing image. So if a nurse is giving something that is really innovative, she would be questioned, is she talking about? She's a nurse. Well, we need to change that. We need to change that in our culture. So the nursing image is a challenge for us. And nurses are really scared and afraid. They feel that what they are going to say is really might not make sense, although they are really sure and they are confident that this makes sense, but they are afraid from the reception and from the outcome that is going to be and the interaction and the action of the people that they are hearing. The culture is a challenge. Nursing shortage, of course, is a challenge. If a nurse is very busy and she's taking care of many patients at the same time, she would care for the documentation, she would care for carrying the orders, she would care for administering medication. Maybe she would not have time to think about what is the solution of a specific problem. The high staffing turnover is really terrible. High staffing turnover, if you're getting a nurse and she sits in the place, she needs at least, of course, the first 3 months are going to be the orientation. But at least she would need 1 year to be familiar or to get familiar with the system. Once she's familiar with them, up she goes. So the high turnover of the nurses is really a challenge and a barrier for the innovative ideas. Work overload comes to the same. The environment who is perceiving these innovation and the organizational structure. Where does the nurse stand in the organizational structure? And we leaders, nurses, everybody has a duty to do. We need to show that we are professionals. We need to show that we are equal. We need to show that we need to be at the high level of the organizational structure of any healthcare organization. So we need a practical guide to unlock the power of innovation within the nursing community. What are the responsibilities of the leaders? They need to empower and to recognize those who are working towards achieving innovation and giving ideas, providing ideas of innovation. They are able to provide staff development and education. Without education, without continuing the education, and especially in a certain specific specialty, you won't be able. We need adequate nursing manpower, and we have spoken about that. We need to foster innovation and encourage individual creativity. Encouraging recognizing is one of the very important measures for retention, and it is also for creativity and innovation. We need to create strategies in innovations. Of course, it doesn't have to work for 1 month, 2 months, and then it goes. No, we need to sustain that. Purchasing of, these are technology, which is purchasing of patient monitoring devices, which would decrease the load of the nurse while she's working in the unit. Purchasing of electronic clinical documentation, and facilitate wireless communication. If you facilitate wireless communication, the communication would become broad, would become higher, the nurses would be encountered with all the situations that they need and the information that they need in order to provide innovative ideas. What are our roles as nurses? Those were of the leaders. Now the nurses, we nurses have an important role in our organizations and in our hospitals. We need to prove the importance of our contribution to innovation, and that it would be by supporting and empowering each other. It's not, we should not work as a sole provider. We should be working as a team, supporting each other, recognizing each other. It would greatly help. And breaking all the myths and changing the wrong perception or perceptions that were given to the nursing image in the communities. Sharing our findings and practices, demanding for more and higher education, and fostering knowledge-based, technology-driven culture. Now, what did we do? Something new at the SFH. And actually, whenever I tell it to anybody, to everybody, to accreditation bodies, to consultants, international consultants, they were amazed with whatever we have done at the SFH. As nurses, we are continuously investigating our operation in relation to our patients everywhere, aren't we? And their comments and their satisfaction. We detected always the gaps, and we educate our staff and build our manpower accordingly. Of course, this is how we are planning the strategies, evaluating the strategies, and correcting whatever we have. So we are always aiming at patient and family patient-centered care. So this is the idea, to have a model patient and family-centered care. So the professional care model we were looking for as we're going in the journey for Magnet. One requirement is to have a professional nursing care model. We need, why? Why do we need it? We sat down and we thought about it. We needed to standardize nursing practice across all the hospital. And of course, it should be a part of our nursing care advancement and transformation. We were continuously growing and witnessing the development of ambitious plan of patient care at the SFH, which nursing has a major role in that, which is normal. We need to guide our nurses. We needed our nurses in achieving the vision of the hospital and demonstrate the commitment of the nursing team and its leadership to a patient and family-centered care model. What did we do? We worked on tailoring our professional nursing care model. We engaged everybody. We engaged the customers. We engaged our colleagues, nurses. We engaged our leaders. We engaged the hospital healthcare providers, pharmacists, physicians, dietitians. We engaged our even board of directors and all the other members of the multidisciplinary team. We surveyed a big sample of the SFH nurses, patients, families, physicians, and other healthcare providers. We ended up with a rich input of their wishes, their opinion, and their recommendations on how they perceive the role of a nurse, how she's going to provide a patient and family-centered care. So our questions were almost a page for each group, and in those questions we incorporated, what do you think a nurse would be called a nurse who is providing a patient and family-centered care? And we got a lot of really huge information and a really database where we worked from there in order to formulate our nursing care model. We had to confirm the presence of a structured patient nursing care by providing firm direction on the delivery of a professional nursing care model. We had also to kick off our journey to attain the Magnet Award, and we were so enthusiastic to continue until achieving that honorable award. So there was enthusiasm and willing to do. So what did we do? On March 18, 2014, we selected our task force and kicked off our meeting. We designed the path and we assigned the tasks. April 29, we served the patient and family, nurses, allied health workers, and of course we planned for the survey and we did it, and we assigned our unit councils that are champions. On May 2014, our survey results were presented and were finalized. July 23, 2014, the survey highlights reviewed for the patient-family-centered care model. October 29, we had the final review, and we kicked off in starting our education plan for all the staff, including all our colleagues from the healthcare providers, to educate them about our nursing professional care. And then we launched it. And this is our nursing care model, patient and family-centered care. And we are planning to present it in this year in the Arab Health in the Emirates for the award of patient and family-centered care. Our plan is we have a data before, we have a database before how was the perception of this and what we were doing for this, and then we're going to evaluate it after the implementation until we will have increase in satisfaction from the patients, from the nurses, and from our colleagues. Imagine one of the very important issues is that the patient, how do you perceive a patient-centered care the nurse is providing? It was only a smile, which is not hard to do it. So the patient would receive a nurse that is providing a patient and family-centered care if she smiles or he smiles. Isn't that very easy? I would suggest before ending to have also in the Arab world, in the Gulf, in Saudi Arabia, a site where we do encourage our nurses to submit ideas for innovation and help them to develop these ideas in order to have a bank of innovative ideas and improve our healthcare and patient care in our hospitals. Thank you.
Thank you, Ms. Raja, for passing your knowledge and sharing your experience. That was really informative. And the next speaker, he's an education coordinator for online education and simulation lab at King Faisal Specialist Hospital and Research Center for Nursing Development and Saudization. He graduated in Maqasid National College of Nursing at Beirut, Lebanon, with a degree of Bachelor of Science in Nursing, and earned his master's degree in healthcare management at Washington International University, US. Please let us all welcome Mr. Hassan Osman.
Good morning. Assalamu alaikum. Put it as a duplicate. Okay, thank you very much. Thank you for the introduction, and good morning again, and thank you very much for inviting me to this nice place. Mr. Tariq, thank you very much for your nice welcome. And I would like to thank you all for attending this, the whole symposium and my presentation in particular. The previous presenters made it simple and difficult for me to present now. Sandy this morning and Dr. Nasif made it very easy for me because they talked about Florence Nightingale and they talked about the first Islamic nurse, which I will introduce later on. Dr. Sahar and Dr. Raja made it also difficult for me because Dr. Sahar was very motivated. She pushed you to the extreme. Dr. Raja was very informative, so I will I will be in between now. Okay. Now, why nursing informatics? Why information technology? I know it's part of innovation. I know it's the trend now. But if we ask ourselves a question, why? Why information technology is so important for us? Who can answer this question? You don't need to answer it, because if you look around you, simply look in your pocket or in your hand, what you are doing now. 90% they are doing text. True or not? 90%. 100% they have smartphones. Do you have smartphone? If you have a smartphone, put your hand up. Oh, at the back too. You don't have a smartphone? You don't like change. Simply. Money? Yes. Change actually is related to budget. So technology is around us and information is around us. Actually, we are governed, we are controlled by technology, we are controlled by informations. Every day we are bombarded with hundreds of information pieces or other pieces. So that's why. During my trip to here in the plane, I was reading the newspaper, and just look what I found. This is, I took the photo immediately with my smartphone, again, so technology, to present it here and to show you the amount of investment in Saudi Arabia for technology. This is Arabic article in Al Madina newspaper, which is published yesterday, the issue of yesterday, and it's that the growing investment in Saudi Arabia is going up to 7.5%, which is a huge number. And if you look at the amount that they pay for this investment in 3.7 billions, very big amount, very big. It's only in the Saudi market. Now, of course, we are talking here about technology in general, not healthcare technology in particular. But remember, this is a very essential part. And maybe at the end of the presentation, I will tell you when I talk about the future, I will touch base about the government initiative in this regard, the Saudi government. So, before moving to to nursing informatics, which is, I will define it and talk about it, let's look at the global umbrella, or the big umbrella that covers all kind of information technology related to healthcare, and what we call the health information technology, or the HIT. Again, this is the big umbrella that covers medical informatics, nursing informatics, medical records, etc. So some terminologies that we need to know, and I'm sure that you are familiar with, but sometimes you are confused because we have, again, hundreds of terminologies. HIS, Health Information Systems, and this is to deal with the systems related to healthcare. Integrated Clinical Information Systems, or ISIS. And ISIS is widely used now in smart hospitals, or who striving for HIMSS number 6 or 5. MCI, Medical Clinical Information. Again, this is related to medical and clinical, but in the information part. Nursing informatics, this is our subject for today. Cows. Did you hear about this term before? The cows. These are the computer on wheels, the mobile stations. MT, mobile technology, taking technology with you. EHR, electronic health record. EMR, which is, again, it's a revolution to decrease the number of medication errors. In the same newspaper, also I took picture, but it's still downloaded on my phone. They were talking about the last year number of medication errors. It was more than 2,000 cases, and some of them, they were at the court. EMR, electronic medical record. Now,